Movement disorders are difficult to treat and can seriously impact quality of life, but alternative therapy is offering hope to millions of people, especially young children. Joining us now to talk about deep brain stimulation is Dr. Ryan Jafrani with the Orlando Health Children's Neuroscience Institute. Welcome.
Thank you.
Okay, so deep brain stimulation, that is a big idea. You need to break that down for us. What is it?
Absolutely. So deep brain stimulation falls under a category of neurosurgical procedures called functional neurosurgery. Now, functional neurosurgery, unlike much of neurosurgery, isn't involved in cutting away bad things like tumors, blood vessel malformations, blood clots from trauma or strokes. It's involved with attempting to change the underlying circuitry of the brain to treat certain disorders, such as you mentioned, movement disorders. In this case, we're doing very small percutaneous procedures to insert things like deep brain stimulator electrodes deep into the brain, into specific nuclei to help modify the abnormal circuitry to provide a functional benefit, such as a movement disorder.
So Orlando Health is one of the few places that you can get this type of surgery, and you are one of only a handful of doctors in the entire country that actually does this. And we are privileged because you're going to explain to us with our prop here, the human skull, as to how this works, because it sounds really complicated.
Yeah, absolutely. We use what's called stereotaxis. This is kind of the GPS of the brain to allow us to target very specific areas in the brain to a submillimetric accuracy. This is actually a stereotactic frame that is used in our procedure to insert the DBS electrodes. It's MRI safe, which is why it's made out of plastic, and allows us to insert the DBS electrodes without ever going to the operating room.
And this is actually the electrode.
Yeah.
It's so thin. That's what goes inside the brain.
Exactly, yeah. So this is an example of one of the DBS electrodes. I don't know if the camera is going to be able to see this, but we use this targeting guide, and it has five different directions of movement to allow me to line this targeting cannula directly to the deep nuclei that I want. The software tells me exactly the depth to insert the electrode. And everything we do, from drilling a tiny hole in the bone to actually inserting the electrode itself, is all done through this targeting cannula. And then a couple of weeks later, you come back for us to connect the system, connect the two electrodes, one or two electrodes, depending on what we've done, to the generator.
When you see these kids' lives improving, how does that make you feel, knowing you had a part in it?
Yeah, there's nothing like it. It's awesome.
And if you would like more information, you can visit orlandohealth.com/children's neuroscience.